People can access speech and language therapy in a number of ways. We see them often at the time of diagnosis when plans are being made for treatment. We like to see patients before they begin treatment, if possible, so we get a baseline of how they're coping with speech and swallow. We will then aim to review patients as they go through treatment, because we know that some symptoms may arise at that time, and we want to be able to help them with those, and we will see them right through until treatment's completed and then afterwards. They can access us through our telephone number, and our contact number is always given in the patient information booklet.
During the treatment, because my mouth was sore, I wasn't using it. Because because I wasn't eating through my mouth, I wasn't using it in that way. And the muscles were really wasting around the mouth, the tongue, and those sorts of things. So we needed the exercises to make sure that they didn't waste away completely, because with the radiotherapy, I suppose there was a chance, I mean, you need the expert here, but I suppose there was a chance that they'd find it really much harder to recover. So you needed to exercise a lot more often. So I was opening my mouth, closing my mouth, and grinning inanely at anything. But I used to get tired of those exercises, and it sounds ridiculous that you're only sort of moving your mouth, that you'd get tired of it. But I find it really quite a lot more strenuous than something like that ever ought to be.
Speech therapy was new to me. I had no idea what that involved. Went for my first meeting, and it just became a jolly good natter for about an hour and a half with my speech therapist about everything from how I'm doing to my life to her life. It was a very positive experience. It was only after about the third visit I realised that this conversation was actually my therapy. And she taught me some exercises to do with the mouth, and these were very useful. I found the best place to do them was in the shower in the morning, where you've got warm water, the mouth you're capable of making it supple, and I would do those every morning religiously for about 10 minutes.
Do you remember those? You had
Yes.
to go buh, 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 stuff like that. Let consonants, repeat these consonants, but put a lot of gusto into them to make them work. But they need to be done.
The only treatment they initially wanted is radiotherapy for my vocal box.
So in the case of laryngectomy patients, where they may have a speaking valve in situ, we will encourage them to continue to use their valve. We want to maintain a good flexible segment for vibration for voice. We will also be very careful at looking at their stoma care, maintaining a good stoma size, and actually treating that if we need to, and perhaps encouraging them to wear something to maintain the shape and size if that's the thing that's needed.
Obviously, I had speech therapy after treatment, and that helped a lot. So learning to swallow again, because I hadn't been able to swallow for nearly 7 months during and after. And I'd had a PEG tube to overcome that, which kept me alive. And then the speech therapy, I could swallow again and learn to talk again.
Speech and language therapists visit me. Even when I was in hospital, they come to visit me. They teach me how to swallow the water, how to do the exercise, and everything. And it's really helpful.
About my speech, it did change, and it keeps changing different ways. Some days I couldn't hardly talk, and the next day or the next week I'll be like this, croaky, and it just changes.
The exercises I know are really important. I'm not a very good person in doing them all the time, but they do help.
But it's certainly important. It can't be dismissed as trivial. It's going to be important to sort of a full recovery in the end.